Well, most of you know that I've been teaching applied neuroscience or applied clinical neuroscience here in Australia for 20 years, but it really all started way back in 1979 when I enrolled as an undergraduate at Phillip Institute here in Melbourne and finished in 1983. Out of that, I emerged quickly into private practice with a fantastic principal who advised me a lot on these types of patients, especially that we're talking about. I worked with him for 6 years, and in 1989, my family and I moved to Dublin in Ireland. And while we were there, I set up a practice again, but I enrolled in a traditional Chinese medicine course for 3 years. After that, I enrolled into a PhD course in the United Kingdom at the University of Exeter. That took me 6 years. During that time, I did a very large randomised controlled trial looking at health behaviour constructs with chronic low back pain, as it turned out. I had no idea I'd end up working in this area. After that, actually during that, someone advised I enrolled with Ted Carrick in an applied clinical neuroscience course, which in those days was, or these days still is, the diplomate of the American Chiropractic Neurology Board. So I completed that course, passed those fellowship exams. And in 1999, Ted Carrick knew I was coming back to Australia and asked me to open up the Carrick course, or the Carrick DACNB course here in Australia. So in 2002, I was the first person to commence teaching applied clinical neuroscience at a postgraduate level for chiropractors here. I've been blessed to probably teach most of the people who are now teaching those courses around Australia. And that was, I've developed great friendships with those people, and it's been a fantastic time to have a legacy of being able to say that I was able to commence something like that. During that time as well, I set up a practice in Glen Waverley in Melbourne, where I only treated chronic functional neurology cases for many years. Saw hundreds, if not thousands of cases, many of them chronic pain patients that we're dealing with now. Through that time, I found myself back doing the research that I was trained in my PhD to do. So we've established some clinical research programs, and one of them is looking at actually central sensitization and postural control, the postural physiology of that. So all that has combined, I think, at the moment to enable me to have the privilege to translate that information to people coming along to the workshop in August this year. And I'm very excited about being able to help people maybe supplement their own treatment and the way they face people with central sensitization and chronic pain in their practices.